Good morning. I'm Dr. Devin Perdue here at Feeling Divine Chiropractic, and this is Tanya.
Hi.
And she is about to get her very first adjustment today. Tanya, do I have your permission to film this and share it on social media so
Of
other
course.
people can learn from your experience here?
Yes, you do.
Thank you. So we've already done the examination that happened last visit, and I found need to order some x-rays, and from those x-rays we have actually calculated a specific listing, a direction and a vector to adjust Tanya so we can take the pressure off of her spinal cord. But we're going to get a baseline of her function today. So we're going to check balance, we're going to check how well her hips are moving, we're going to be checking muscle engagement, we're going to be checking skin temperature, and a few other things before we deliver the adjustment. And then we're going to recheck all of the things we checked before and look for change. All right, so please face the mirror. Stand up nice and tall, close your eyes, and what we can see in the mirror is that Tanya's head is tilted slightly, that her right shoulder is higher than her left shoulder, and that her right shoulder is rotating forward compared to her left shoulder, and that her left hip is higher than her right hip. So we can see all these things in the mirror with the nice parallel lines. And Tanya, while your eyes are closed, please go ahead and balance on your right leg. I'm guarding you, so arms have to stay down, please. I'm going to guard you. You're not going to fall. Okay, so she's able to balance, but there's significant wobble, and she's fighting very hard for that. Go ahead and see her postures even become more exaggerated. Go ahead and balance on the left now. All right, arms stay down, please.
I'm trying.
I know, I will not let you fall. I'm right here. Okay. All right, and arms stay down. There we go. And she's falling over. Okay, you can open your eyes. Yeah, see how much you've turned?
Yeah.
It tells me your brain and your feet are not talking properly. Go ahead and pedal your right leg in the air, knee nice and high. Thank you. And I do feel some restriction in that SI joint on the right side. And let's compare the left side. Go ahead and pedal the left leg. And this side actually does move more freely. Thank you. Tanya, what was the main reason you came in here?
My hip, my right hip.
Your
No,
right.
I'm sorry, it's my left hip.
It's your left hip that is
Yes.
that is painful. Okay.
Yes, very painful, and then of course headaches and a lot of neck pain.
Right.
In general.
Okay. Please have a seat.
Sure.
Okay. And we're just going to palpate under the neck. We're looking for the presence or absence of edema in the suboccipital region, and I feel right there. Is that pretty tender?
Yes.
Right there on the right side. And we're going to be checking skin temperature. All right, 33.7 degrees Celsius on the right, and 33.6 degrees Celsius on the left. Thank you. Stay right there. Let's also check your grip strength. I'm going to ask you to put your thumb and your pinky together. Thumb and pinky, please, just like that. 3, 2, 1. Hold very strong. Excellent. Very good engagement. And on the left side, 3, 2, 1. Hold very strong. And you're trying every bit as hard here, correct?
Yes, I am.
All right. That's 3, 2, 1. Hold very strong. And that engagement just isn't the same. Thank you. All right. All right. Adding paper. We're going to have you lay on your back.
Okay.
Go ahead and lay on your back, please. Okay, thank you. And scooch down so that your feet are just off the end of the table. Very good. And we're going to be looking at her legs because we're checking for pelvic imbalance. And if we can zoom in on her feet here, like leg, letting it roll off to the side, resetting the leg, letting it roll off to the side, very light pressure to make them match, and I see that this left leg is pulled up about 3/4 of an inch compared to the right leg. So if you can see that,
Yes.
yeah, and we're just gonna go up here and palpate the lumbar muscles, and much tighter on the left side
Yeah.
than the right side. Okay, let's have you sit up, okay?
Sure.
Face that way, please. All right. And we're going to set the headpiece for your adjustment. listing so I can see it. And I would like for you to stick your right arm straight out to the side. Look, that side, please. Thank you.
You didn't say which side, sir.
I did not. Okay, I would like for you to scoot your butt about 3 inches that way, please. Very good. And, ooh, too much. Come back 1 inch. Much better. Thank you. You can relax that arm, bring it down. And this arm's going to be straight. And we're just going to sort of pre-position you. I want your head up, looking straight ahead. I'm going to be moving your shoulders around.
Okay.
And leave your head right there. So drop this right shoulder. There we go. And we're going to roll your shoulders a little bit this way. Good. Right there. A little more. Right there. Perfect. Okay. I'm going to lay it down on your side. This hard part of bone right behind your ear, I'm going to lay it on that firm corner in that block I just set in the headpiece.
Okay.
And I'm going to help you lay down for the first time. On the count of 3, you're going to swing your body down onto the table and your legs are going to come up.
Okay.
All right? All right. Ready? 1, 2, 3. Come down. I got you. All right. Very good. Relax. I got you. You just hold your ear out of the way and relax. Sort of let your head fall over that ledge. Try to relax.
Hurts my ear.
I know. Try to let's get your ear folded out of the way. Better?
Yes.
Much better. Good. Relax your head. Relax your head. There we go. Good. Stack your feet. Good. Stack your feet. There we go. Relax your head. All right. I'm going to be fine-tuning this now. Try to stay where I place you. Relax. Soften. Relax. Drop the head. Nice. Very good. Okay. Very good. Okay. And now for her listing. Relax. Stay right there. So these are measurements that I took from X-ray, and I am transferring them to her body. And then, so we get a triangle, and then her correction vector, stay, is going to be along this hypotenuse here. Relax your head. Beautiful. Okay. Let's have you lay on your back again. Get that out of the way. Oh, losing the paper. Good. Right there.
Feet off the table.
Yes, ma'am.
Okay.
Feet off the end of the table. All right. Now resetting the hips again. Okay, your feet are completely balanced. If we can get a nice shot of that. Compared to before, feet are completely balanced. And checking the lumbar muscles. Those are nice and soft right there. Feel how calm that is. Okay, I'm going to help you sit up. Grab my elbow. 1, 2, 3. Good. Pivot around to face me. We're going to check your grip again. 3, 2, 1. Holding very strong. Excellent. Good engagement. And the left side. Check temperature again. 34.2 on the right. 31.4 on the left. So we've had big changes. Your body's going to go through some rebalancing. Let's have you stand up and face the mirror.
Okay.
Good. Let me get behind you, please. There we go, right there. Okay. Feet all the way together. Stand up nice and tall. Close your eyes. All right, notice how much this right shoulder has come down. Her shoulders are rebalancing. We're not having it twisted like it was a minute ago. her hips are balanced. My hands are right at the top of the iliac crest, and you can see that they're even. And all right, Tanya, go ahead with your eyes closed. Balance on this right leg with your arms by your sides. Good. That's much easier, isn't it?
A little bit.
A lot of it. Your hands are staying down. You're not compensating as wildly. This is much, much easier. Go ahead and close your eyes. Balance on this leg. Good, good. Thank you. All right, you can open your eyes. Pedal your right leg nice and high, knee nice and high. Okay, much better. Much more freely moving through that SI joint and this side. And again, much easier, much more freely moving at that SI joint. Well done. Thank you.
Mm-hmm.
Okay, so we have that was Tanya's very first adjustment here at Feeling Divine Chiropractic. How'd that feel?
I didn't even feel you adjust anything, which is the oddest thing. And I can tell I have more strength and it's not as tender in my neck, which is very odd to me. Being honest. Because I didn't
Is this
feel
like
any
any other chiropractic visit you've ever had?
No, because usually when there's a lot of pressure and you feel like the crack in the spine and you hear like the cracking in that and it's a lot of pressure and they usually onto you and it's not, I won't say it's hurts you, but it's a very different feel. And whatever you did to my neck, I didn't feel you do anything to my neck besides like touch it. And it was like, that was it?
That was it.
That was the adjustment.
Yep.
And
So
that was all I felt was a touch to my neck.
And your whole body is getting better from that. All right, thank you for letting me record this.
No problem.